Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. Today we'll provide another COVID-19 update from the hospital perspective. So let's get started. This slide shows hospitalizations across the East Tennessee region. The region is defined by the counties at the bottom of the slide. If you follow the purple line, which is all the patients in the hospital each day, you see that the peak occurred between last week and this week. And so we're currently at 598 patients in the hospital as of February the 8th. And when I last updated you, that number was 699. So this now shows a consistent trend in the right direction. This is good news. At our hospital, we're now at 138 patients in the hospital with COVID-19. Our peak was around 180 with the Omicron surge, and when I updated you last week, this was 171. So again, a consistent trend in the right direction. This shows new cases per 100,000 population in Knox County. And if you look in the red circle on the right-hand side, cases are clearly dropping. This is consistent, both the 14-day and the 7-day trend line. So what I've shown you today is that the Knoxville region is definitely improving, both in terms of cases of COVID-19 as well as hospitalizations of COVID-19. This is very good news. If you look at the models that try to project the future of COVID-19 through the end of March, at this point they look pretty promising. Now we know that Omicron really came out of nowhere and affected us within 2 months of it being identified. So that can happen, but at least based on the information right now, we're hopeful to at least get a reprieve, hopefully a several-month reprieve from what we've been experiencing related to the pandemic. We know warmer weather is on the horizon, and that's potentially good news. And we also know that pandemics have a life cycle. They don't last forever. So all of these things are reason for hope. The other side of this, though, is we have to remember that we still have a substantial amount of COVID-19 in the community. So just because these trends are headed in the right direction doesn't mean that the risk has gone away. And so I'll close today the way I always do. So we still have a significant amount of COVID-19. So mask wearing, vaccination for now and for the future, boosters, and absolutely still, if you have symptoms that are at all suggestive of COVID-19, please get a COVID-19 test. As always, we appreciate your time and attention. Given the improvement that we've just discussed, we will no longer plan to do these weekly videos, although we will continue to post our data dashboard if you're interested in the hospital situation. We'll continue to monitor the situation closely, and if it's ever warranted, we'll return and just pick up right where we left off. Again, thank you for your time.